So we'll look at food updates in terms of their relevance to the natural health product sector. A couple of things that are happening on the food side. Recently, a letter was sent to the industry regarding foods containing phytosterols and plant sterols. These ingredients in foods were evaluated as novel foods. There are specific regulations on the food side pertaining to novel foods, so any foods containing a phytosterol or plant sterol needed to be evaluated for safety. Following a review of the evidence, the Food Directorate decided that they had no objection to the sale of certain foods containing up to 1 gram of phytosterols per reference amount and serving size. So you are now able to add these ingredients to specific food products. Those food products are unstandardized spreads, mayonnaise, margarine, salad dressings, yogurt and yogurt drinks, and vegetable and fruit drinks. You're still required to file a notification of your intent to sell these foods as per the novel food regulations. So it is allowed, but you do need to notify the Food Directorate of your intent to use these ingredients in those specific food products. Further information was reviewed in terms of the efficacy of these ingredients, and based on the evidence, it was decided that a claim was supported in terms of lowering total blood cholesterol and LDL with no detrimental effect on high-density lipoproteins. So proposed claims that can be put on product labels, X amount of a certain product provides Y amount of the daily amount of plant sterols shown to help reduce or lower cholesterol in adults. So there is a cholesterol lowering claim now potentially being permitted for food products. It's my understanding a regulatory amendment still needs to go through, but the science supports this claim for food products. So we should be seeing regulatory amendments shortly to allow these types of claims. Again, right now it's only specific food categories that can take advantage of the addition of phytosterols and plant sterols, and there's certain nutritional requirements that need to be met for those products as well. It's possible that an interim marketing authorization might be available to put the claim on the food prior to the regulations being amended. So as I say, right now the safety has been confirmed. You have the ability to add plant sterols and phytosterols to certain foods, but you must notify the Food Directorate in advance, and there will be amendments, regulatory amendments to allow the claim, but possibly an interim marketing authorization you might be able to get one to allow the claim on the food in the interim. The other change that's being looked at on the food side is in terms of gluten-free labeling. We talked at the last webinar that changes were coming to the allergen labeling requirements on the food side, and some of these were being mimicked on the NHP side. In response to those proposed amendments, there were some comments that oats should not necessarily be included in the definition of gluten, because products containing oats would not be allowed to have gluten-free on the labeling, and there's been some evidence submitted that shows that sensitive individuals can tolerate some levels of gluten from uncontaminated oats. So if the oats haven't been contaminated with other grains, then gluten-sensitive individuals can consume these without any adverse events. So this would just allow more products to be labeled gluten-free if this indeed goes through. So this is potentially of importance to the natural health product sector just because some of the policies specifically around allergen labeling tend to mimic what's happening on the food side. So again, you can see the information that came out regarding natural health products containing gluten on the NHPD's website, and the information on the gluten-free labeling proposal is on the Food Directorate website, and the consultation on the proposals goes until July 11th of this year. So we'll just look at a couple of other updates. One is a letter that was issued by Health Canada regarding the drug to NHP transition. This was a general letter to private and public drug plan administrators as a result of numerous complaints that Health Canada was receiving from consumers and from the industry about products being delisted from insurance coverage plans. And the insurance companies were saying it was a result of the products being reclassified from drugs to natural health products. And Health Canada's response is basically it shouldn't make any difference. Natural health products are still a subset of drugs. There's been no change in the inherent risks or benefits of these products. So don't blame it on us. It's your, it was your own business decision is basically what it says. The other programs, again, we mentioned in our last update, are the hazardous waste programs. Ontario has implemented one of these programs. Quebec and Manitoba are also following along. This is looking to industry to share in the cost of recovering, recycling, disposing of hazardous materials and special waste. Unfortunately, natural health products are captured under this title, and there are surcharges being applied to the amount of product being sold within the province. So there's more information available online. This is really just a heads up that if you are a brand owner or first importer of natural health products and you reside in Ontario, then you have to register as a steward. The deadline is already passed, but you are still legally obligated to register as a steward, and then a quarterly report is due for the April 1st to June 20th period, and fees are applicable. So these are legal requirements. You're legally bound to register, submit your forms, submit your reports, and pay your fees. The last update is regards to Made in Canada, Product of Canada claims. Previously, criteria was set out for food products when they were allowed to make these types of claims. The Competition Bureau, which is an independent agency, has come out with their own guidelines, which are interpretation of the misleading sections under the Competition Act, the Consumer Packaging and Labeling Act, and the Textile Labeling Act. So taking these acts into consideration, they've set out criteria for when you can make claims for Product of Canada and Made in Canada on non-food products. And non-food products are anything that's not defined as a food in Section 2 of the Food and Drugs Act. So that would encompass natural health products. So again, I encourage you to go to the website, competitionbureau.gc.ca, and look at the criteria. Basically, Product of Canada claim is allowed when the last substantial transformation of the good occurred in Canada and at least 98% of the total direct cost of producing or manufacturing the good have been incurred in Canada. A Made in Canada claim can be made when the last substantial transformation of the good occurred in Canada and at least 51% of the total direct cost of producing or manufacturing the good have been incurred in Canada. So you see these guidelines would apply to natural health products. So this brings us to the end of our second regulatory update webinar. I hope you've enjoyed it and found it to be informative. A video of this presentation, as well as a list of all the websites mentioned, will be available on Dicentra's website within the next few days. I strongly encourage you and would hope that you will be able to fill out the survey. You can see the link there under the chat room. It will help us better cater to your needs and meet your needs in designing these webinars. We'd also like your feedback to see on how they can be improved. So please mark your calendars. Our next regulatory update will be on Wednesday, September the 29th. And again, please visit our website at www.dicentra.ca or by contacting us at 1-866-NHP-EASY. So thank you very much and have a great day.